and welcome to Unstress Health. My name is Dr. Ron Ehrlich. Well, today we are diving into a topic that affects so many men and for that matter, it affects so many of their partners as well, and yet often it remains hidden, never discussed, and that is the topic of sexual health. Now, my guest is Dr. Anne Truong, and Anne is a pioneer in this field with over 25 years of experience in anti-aging and regenerative medicine, and she shares her own personal experience with her and her husband. She's helping men reclaim their vitality through cutting-edge treatments and holistic approaches. Now, there's a common theme that runs through so many of our programs, and it's interesting to hear how the solutions may sound also remarkably similar, although there are some real cutting-edge stuff here that you need to pay attention to. Now, she is the creator of, and here's a catchy title if there ever was one, The 6 Systems to Get Hard, and the host of Sexual Health for Men podcast. Now, Dr. Anne is breaking taboos and empowering men to take control of their wellness journey. And get ready for this fascinating conversation that challenges conventional thinking and offers some real solutions. I hope you enjoy this conversation I had with Dr. Anne Truong. Welcome to the show, Anne.
Thank you for having me here.
And I'm always intrigued to hear about a practitioner's personal journey into their area of specialty. And this area of specialty, of course, is something that is of interest to at least half of our listeners, if not all. Could you just share with us what drew you into this specialty of men's sexual health?
Right. So, like, why would a woman like me, not a man, talk about men's sexual health? Well, I not only talk about men's sexual health, but women's sexual health as well. But I focus it more on men. And the reason why is actually for selfish reasons. It's for self-interest. So I in my mid-40s, I was noticing that, I was having some sexual issues as well. And and so was my husband. And my husband also had some heart issues, and he had a procedure and had to be on a heart medication. So when you're on heart medication, it affects your sexual function, and that is also contraindicated to even take any type of ED medication. And since being a doctor, and I have backgrounds in doing acupuncture, and from doing acupuncture, I know that I've learned how the body can heal itself and how the body is really one organ rather than separate organ. And I wanted to find a natural solution for sexual dysfunction, particularly ED. So that's when I deep dive into it. And at that time, I was already doing stem cell therapy for pain. So I am a board certified medical doctor. I treated over 37,000 patients for pain. And one of the things that I use is using your own stem cell to treat and reverse the condition. But with that knowledge, I dive deep into how to restore sexual function and did a lot of research. And I, as well as my husband, were my own first patient. And that's how we explore and redefine or get heart system that we are using now. And I have found that, your sexual function really just needs to be reawakened and boosted for it to start work again. And oftentimes it's down to the basic thing that we take for granted that is pivotal to sexual function. So my interest in this is, again, it was self-interest, and then it became a passion because I feel that sexual health is such an integral part of our health, and it's integral part of who we are, but yet is shameful, it's dirty, it is a taboo. We talk in the closet, we don't talk it openly, and it's even prohibitive to even talk about the sexual organ name on social media. But yet, we see movies that are, sexually explicit all the time. But if I say the word penis on social media, oh my God, my video is banned, and it's like, I get a warning from social media. So it's such an integral part of who we are, and it's really, if it weren't for sexual activity, we wouldn't be here, right?
That's it.
And
That's it.
so it is, we wouldn't be here. And so I wanted to really, our passion is to raise awareness of sexual health and alternative to treatment for sexual dysfunction besides just medication, and to bring it to the forefront, like what we are doing now with mental health.
Yeah.
That is
Yep.
not shameful, it is not dirty, and it's not weak if you have it.
Yes. And it's always interesting, isn't it, as a health practitioner to motivate your own personal journey, because we're not just practitioners, we are individuals on a journey through life. And when something comes up that challenges us, particularly health-wise, and we happen to be health practitioners, it can certainly drive our interest even deeper and further. And it's interesting I mean, that's why I was so looking forward to talking to you, because I do believe, as you've said, it's a taboo. But to put it into perspective, and you mentioned heart medication affecting sexual health, and one can only imagine the effect that so many other medications have on sexual health. I'm thinking particularly antidepressants and the ubiquitous nature of
Mhm.
those. I mean, how big a problem is sexual dysfunction? People not being as healthy in their sex lives as they would hope or like.
Well, it's very common, more common than we think. And there was a large study that was done in 1994, that's a long time ago, that shows that 50% of men over 50 have ED. It's very, very common. The reason why it's common, and that rises as you get older. 60% have ED when they're 60, and 70% have ED when they're 70, as well. And so the reason why that ED is so common is because ED is affected by common condition as you get older. When you get older, you have high blood pressure, you have high cholesterol, you have diabetes, you gain weight, you become more stressed, you don't sleep as well. So all these factors accumulate as you get older, and ED, ED is really defined as decreased blood flow. You're not getting enough blood flow to the penis, and therefore you're not able to get a functional erection. And all those conditions that I mentioned, high blood pressure, diabetes, and high cholesterol, or being overweight, stress, and not sleeping well, all of that compounds, and it happens to happen when we get older. And then also, as we get older, we also tend to make less testosterone or hormone, which also affect the erection as well too. So there's a lot of factors that plays a role as you get older, but they're all reversible. They're all reversible except for maybe testosterone. Now you can increase your testosterone innately, or by with diet and exercise, but sometimes you may need a little bit more supplement to kind of get it to a range that is optimal for you. But high blood pressure, high cholesterol, diabetes, we all know a reversible medical condition through changing in your diet and your exercise. So it's more common because we tend to have more common aging disease, but it doesn't have to be that way.
Yeah, well, I'm looking forward to talking about that. But also, another one that throws us into this area is prostate cancer, too, isn't it? Which well, there's a whole controversy around whether people die from a prostate cancer or with prostate cancer. The
Yeah.
the difference, and of course, people who get a diagnosis may be pushed towards surgery, which creates a whole range of other issues. That's a big problem too, isn't it?
Yes, let's be clear. Testosterone replacement therapy does not contribute to prostate cancer.
No.
right? It
Okay.
actually is helpful for cardiac condition, and it's also helpful for erectile erection as well. Now, benign prostatic hypertrophy, which is enlarged prostate, that is not cancer, actually increases in the same number as incidence of ED. So by the time you're 50% of men have enlarged prostate, and 60% of men will have enlarged prostate. Now, enlarged prostate itself does not contribute to cancer. It just happened to be there. And some men have prostate cancer will have a very low PSA number. That's a normal PSA number. And so that's why it's a little concerning when you have a higher PSA number that it may be prostate cancer, but you have to watch. We see a higher incidence of prostate cancer, and prostate cancer is really the prostate is really more affected by the DHT, which is the inflammatory metabolite of testosterone. DHT is dihydrotestosterone, and that is what makes the prostate inflame. And that is a hormone that is kind of a bad hormone, that is a precursor from testosterone. And that hormone actually increases with poor diet and no sedentary activity. And so that's kind of correlate with, what I said about, sexual health maintenance as well. So with prostate cancer, it is a mixed bag. You're right. Do people die with it or from it? Because men that get it are also older. They're also frail, and they have undergo, surgery, and then or they undergo treatment, which then 99.9% of them, the sequela of prostate surgery is ED. And so they end up having ED, and then they have to deal with that and having the stress of that on top of the cancer and everything else. So you kind of wonder, and I don't think the verdict is out there. I don't think it causes death. I think because the prostate cancer is in most of the form is slow growing versus fast growing, and oftentimes it affects men that are in their 70s and 80s as well too. So
Mm.
it's more controversial than we think.
Yes, and I think the other thing about it is that if your sexual health, if your sex life was one way before you had prostate cancer, after, it's not going to get better after it, is it? Like, so it's good to get yourself optimally sexually healthy. It's almost an oxymoron, isn't it? Because all the things you've mentioned here about sleep, about blood pressure, about diabetes, about putting on weight, about this, about that. I mean, it's obvious that we do need a holistic approach to this problem, which is why I'm so intrigued into the fact that you've developed and this is a very catchy title, Anne, the Six Systems to Get Hard protocol. And I'm intrigued by this systematic approach, not just the name, but what it involves. Could you walk us through these systems, how they work together to improve sexual function?
Yes, yes. So actually, that name came from a friend.
Okay.
We were sitting on a bus together, and we were going to an outing, and she'd go, "Why don't you just name it the Get Hard System? Because that's the end result. That's what happened." And I said, "You know what? You're so right." Because I was debating on how to name it, and he said, "Just think about it. It's to get hard." I'm like, "Okay." So anyway, that's how we got the name. So I thought it was a good story, and
Okay.
it came out from
It's catchy. It's a
really
catchy
looking
title.
at the whole sexual health. Yeah, but I don't have to explain what it is it? When I
No,
say the title, everybody knows what it means, right?
that's right.
Exactly. So, and the reason why I said that is because it doesn't have prohibitive words. If I say the word sex, if I say the word sexual health, if I say the word erection, it will be banned everywhere. I have to use words that are not banned. So I have to tread very carefully what words I use, or else
Mm.
it'll be banned. And so the word hard doesn't get banned. The word ed doesn't have banned. But if I say the word erection, it'll be banned everywhere, right?
Okay.
Because in this social media world, nobody gets an erection, right? You can't talk about that, right?
Okay.
So, but anyway, aside from it, the sixth system,
Yeah.
it comes from really the knowledge of thinking of your body as a whole. It's an interconnected system. It no organ, it works in isolation. And that the first thing I want to say is that your erection starts in the brain. Right? Your erection starts in the brain. It doesn't start in your penis. How do you get an erection? It starts in the brain. If it doesn't happen in the brain, nothing's gonna happen below the belt at all.
Hmm.
And so that's how I came up with it. When I learned about that, I was like, God, that makes so much sense because we have so the response starts in the brain. That's how we have arousal, desire, right? That
Hmm.
starts in the brain. That
Yep.
starts in the brain. And what feeds the brain the information is our five senses. It's our eyes, what we see, what we smell, right? What we eat, the taste, what we hear, sound, and what we touch. At the five senses. I even call it fantasy, your ideas in your mind, your fantasy, the sixth system. But that all feed into the midbrain area where you start to stimulate arousal, and that's where so that's system number one is the brain, is where you focus on stimulating the senses, which then go to the brain area that stimulate that mixed with emotion, because your psychological state, your emotional state gets all blend in with the sensory input as well. So meaning if you're depressed or if you're anxious, then that get mixed in and may dampen the signal. But if you're relaxed, you're enjoying the moment, then that gets carried through to the next step. So your emotional state almost acts as a filter for the stimulus that gets sent in. And so like that, all the five senses and even your thought, it goes through the filter of your emotional state. So that's the emotion. That's the second system. And the third system is your hormones. All right, because that filter to the emotion, and then and the hormones gets released in the hypothalamus and the brain, that releases all these hormones and chemicals that initiate the process of the nerve. So that goes to the hormone that initiate the nerve in the back of your brain right here. It goes down the nerve and in the chain that's called the parasympathetic nerve that goes down, which then increases your so the nerve is the third one. And we said the brain, the emotion, the hormone. I'm sorry, the nerve is the fourth one, which then it
Hmm.
goes to the nerve, right? It goes to the nerve, and the nerve goes to the heart, which then increases your heart rate, which then increases more blood to flow down. So the fifth system is the blood vessel and the heart, and
Hmm.
then the sixth system is the penis muscle. So that's
Hmm.
a sixth system because you have to increase your heart rate. Your heart rate will pump out the blood that goes to the blood vessel. The blood vessel is open, and therefore the penis muscle has to be in a relaxed state in order for it to get more blood flow to create a functional erection. And what's interesting, when I first got into it, it was the opposite, because when we exercise, our when we do like a bicep curl, our muscle has to be contracted in order to do the curl, right? And it has to be
Hmm.
relaxed when you're in relaxed state. But the penis muscle, or the corpus cavernosum, is a smooth muscle, so it has to be relaxed in order for it to get an erection. And when it's not in an erected state or a flaccid state, then it's actually contracted. So when you don't have an erection, the penis muscle is actually contracted. It is not relaxed. so it needs to be relaxed in order for it to expand, to take in all the blood flow, and in order for to create an erection. That's the reason why that if you're not right up here, if you're stressed, and if you're anxious in your mind, your penis muscle not going to be relaxed. It's not going to be relaxed, and it's not going to get an erection. All right, and I'm talking to the men. How often do you feel that when you're distracted, you're still thinking about work, or there's some things that worry you, or whatever, and you're in the heat of the moment, and the erection just not as good as it used to be, right? Because the penis muscle is not fully relaxed. So when it's not fully relaxed, it's not going to it's not going to accommodate the blood flow that it needs, and therefore it's not going to be able to expand. When it's not expanding, it's not going to be able to keep that firm erection to be a functional erection. And to all men, when that happened, men think there's something wrong with them when it's not. Maybe you just had a tiring day. Maybe you just distracted, had a stressful day, and you just need to be in a better state here. So that's why I said that the brain is the largest sexual organ. If the brain, your emotional state is not in a right state, nothing's gonna get filtered through. And so that's why when we work with men with sexual dysfunction, we go through each of those systems to check it. Right. One, is he using his five senses? How is his emotional state? Is he depressed? Is he distracted? Is he stressed? Right. And then the next part is we measure the hormones level. We do blood work. We do blood work to look at your testosterone, look at your FSH, LH level, look at your prolactin level. All right. We also look at your thyroid as well. And then the next phase is that for the nerve, we can actually find out whether you're inflammatory state. We look at inflammatory factors as well. And then for the blood vessel, we look at nitric oxide level, which can be measured from the saliva. And we also look at endothelial dysfunction blood work as well. And we can also measure blood flow to the penis with the penile Doppler ultrasound. And that's how we can see how the muscle is working. We can see how the blood flow is working down there. And that's one of the reasons why we use shockwave therapy.
Yes,
Shockwave therapy uses sound wave energy to the penis to stimulate more blood flow. And that's one. Our main treatment is with your own stem cell, which are the platelets in your blood. We inject that into the penis to again increase blood flow. And also it help with the flexibility or relaxation of the muscle. We're also now doing Botox too. Botox, the same Botox that goes to the face for wrinkles. Now we inject it into the penis because remember what I said earlier, in order for you to get an erection, the muscle's got to be relaxed. So sometimes the muscle is not relaxed. So now we're injecting Botox in there to help it relax as well too. And but all that, it's a really boost more blood flow to the penis. But in the end, he has, the man still has to work on his diet and his exercise routine and sleep and stress management. Because he doesn't do that, then internally his body is still going to be in inflammatory state, and that if he wants the treatment to last longer, he needs to work on that. The treatment is really to boost, to give it a boost, but in order for it to continue longer term, he needs to work on the four pillars of sexual health, which is diet, exercise, sleep, and stress reduction.
Wow. Well, isn't that a common theme? I mean, I could be doing a program on cancer, autoimmune conditions, mental health, you name it. I could be doing a program on any of those diseases, and this will be a familiar story. What, this again? What? It's back to diet, stress, sleep, and exercise. Surely it can't be as simple as that. But it is, and how it manifests
It
itself
is.
is our genetic predisposition. You've mentioned, I mean, it's so interesting to hear you put the brain up there as the main sexual organ, because I think often it's said that men think through their penises, but actually, there we go, the brain. And given the ubiquitous nature of mental health, of stress, of hormone disrupting chemicals, of chronic inflammation, I mean, it's a wonder that any of us have a normal sex life.
Yeah, you're absolutely right. Yeah, there's a lot of factors in our environment and in our diet and in our lifestyle that predispose us to have sexual dysfunction. That's why it's like that study was done in 1994 that shows that 50% of men over 50 have ED, but that doesn't account into our processed food, our lifestyle now, internet, and then COVID. So I think that number is a lot higher. And like you said, I in my 40s I had sexual dysfunction, and so was my husband, who, and we're both in good health, and we don't. I don't take prescription medication, but it's all hormonal. But the good part is, the good part is, yes, as you get older, you're predisposed to it. But the good part is you don't have to accept it. It is reversible. There are things that you can do to maintain sexual longevity. And I want to stress it's not about sex, because because when you have good sexual health, that means good general health.
Yes,
That means
yes.
longevity. That
Yeah.
means quality of life. We're not just talking about sex here. We're talking about quality of life, living longer, being more active. Because studies have shown that people that has more sexual intercourse, like 3 times or more in a week, 3 times or more in a week, live longer. They have less cancer. They have less heart disease, less dementia, better quality of life, better relationship. And so that's what we all want, right? We all want quality of life as we get older. And so, but again, how do you prevent that? How do you treat that? Back to the basic and the most simplest stuff that is in front of us, but we like to chase shiny object, right? We want to get this device, we want to get this and that, thinking, oh, this pill is going to take care of it, when it's really down to diet, exercise, sleep, and stress reduction. Because I can guarantee you, we have more sexual dysfunction now in 2025 than we did in 1925.
Yes, yes, I've no
You
doubt.
know, in
I've no
19
doubt about that. Hi, Dr. Ron here, and I want to invite you to join our Unstress Health community. Now, like this podcast, it's independent of industry and focuses on taking a holistic approach to human health and to the health of the planet. The two are inseparable. There are so many resources available with membership, including regular live Q&As on specific topics with special guests, including many with our amazing Unstress Health Advisory panel. Now, we've done hundreds of podcasts, all worth listening to, with some amazing experts on a wide range of topics. Many are world leaders. But with membership, we have our Unstress Lab podcast series, where we take the best of several guests and carefully curate specific topics for episodes which are jam-packed full of valuable insights. So join the Unstress Health community. If you're watching this on our YouTube channel, click on the link below, or just visit unstresshealth.com to see what's on offer and join now. I look forward to connecting with you.
Yeah.
Well, when you outline those 6 systems, and you break that apart, well, I mean, as like I said, when you put it like that, it's a wonder anybody's having sex at the moment. But it's interesting. You've mentioned a few things there. Shockwave therapy is an interesting one, because we did a program on that a few months back, and it was interesting. Just tell us a little bit more about shockwave therapy and how it's used, how often it's needed to be used. Is it a regular ongoing thing? What's the story with shockwave therapy?
Right. So it's really shockwave therapy. It's called shockwave because when the energy hit the tissue, it feels like a shock, but it really harnesses the power of sound wave technology. It's the power of sound wave, and it goes through either a magnet or it goes through water from the machine that transfer that energy into kind of like a laser beam. All right. And that energy is like a laser beam and it can penetrate as far down as 9 inches. That's the focus shockwave. It's called low intensity shockwave therapy or focus. Focus shockwave, which is the one that's been researched the most to be effective for ED. There's another machine shockwave called radio shockwave. That's more acoustic. That's more using acoustic shockwave. It's really more in using more mechanical shockwave, not the energy of sound. So that's radio. They're two separate shockwave, but they're often used interchangeably. But the one that has been researched the most is the focus. The radio is really more mechanical shock to the tissue. So what I'm going to be talking about is focus shockwave. So it harnesses the energy of sound wave and either go to a magnet or go to a water and then it transfers that energy and it goes as deep as like 9 inches. And when that energy is transferred to a tissue, like either you can use it on the knee, you can use it on the shoulder, you can use it on the penis, but it all does the same thing. What it does is it decreases inflammation and it actually will increase mitochondria, increases ATP, and it actually on the end point, what it does is that it increases cellular mechanism for healing and angiogenesis. Angiogenesis, the ability to make more blood vessel for healing, because you need blood to heal. Blood is the river of life. If you don't have blood, you're not going to be able to function. You want healing, you need blood. So all the endpoint of what shockwave does is to bring in more blood flow or condition that we call angiogenesis. I can go deep dive into it more, but it's really increases ATP. It increases a lot, even a lot of cellular action as well. And so it takes about 20 minutes to do. But again, you can do that on the shoulder for shoulder pain. You can do that on the penis. You can do that on the woman vulva area. In the end, it's about restoring blood flow again. And the treatment takes about 25 minutes. And the recommended frequency is about once a week for 6 weeks or twice a week for 3 weeks. In some instances, it may need to go as far as 12 sessions instead of 6 sessions. So the more severe the condition is, you do more treatment, and the milder it is, you do less. And it's a treatment that is done in the medical office, and it's non-invasive. It's on the skin. It's non-invasive. There's no injection. It's almost like taking a massager and kind of like going up and down the treatment area. It feels, and it doesn't make any noise. The focus just makes a little like chick, 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 chick. It's like a little tick, tick, tick sound. And it's very, very tolerable. It's non-painful, and it's not an injection or anything like that. And you come in and you can leave and you can resume your usual activity. But it's been very powerful, as it is one of our main tool that we use to restore sexual health, along with using the stem cells and the Botox that I talk about. But we also use the shockwave therapy to help with pain as well. Very good with rotator cuff pain. It's very good with hip pain, low back pain, neck pain, and knee and ankles. Yeah, you just have to know the anatomy, and you have to know the source of the pain to target that machine. So it's a very powerful, useful machine.
Interesting. It's interesting you mentioned it because it was something I was intrigued about after our program with a chiropractor called Adam Gavin, who talked to us about shockwave therapy. I think Dave Asprey, who's a well-known character in America, has been very instrumental in introducing it.
Mm.
The other one you've mentioned it a few times, stem cell, and I know people hear this and think, wow, this is cutting edge medicine, and it probably is. But I wondered if you might just share with us some of the basics, as you've just done so nicely for shockwave therapy, about stem cells. How does that work?
Well,
Yeah, tell us about stem cells.
yeah. So the stem cell, our body has stem cells that are in abundance. And we have the healing ability to heal ourselves. Like for instance, if you cut yourself, you cut the finger, what happened? The blood goes into that cut, and then the platelets are the one that create the clot. And then over time, that cut becomes a scar, and then over time, that scar disappears. That's your own body stem cell working. That is on automatic. So what we do is that we know that the platelets are the ones that create the clot and are the ones that start calling all the other cells in the body to come and initiate the repair response or the healing response. So the stem cell that we use for restore sexual function are the platelets. The platelets are cells that your body make in the bone marrow that comprises about 1% of all your blood. So we have 5 liters in as our blood. It comprises 1% of that, and those cells are the one that creates a clot, but it also sends messages to the other cells in the body. Say, hey, come here. There's an area of injury. Let's heal this, right? So how we harvest the stem cell is that we would do like a venipuncture, like the same thing you would go to the lab and get your blood work draw to evaluate for like your blood sugar or your cholesterol level. It's the same thing, but we take a larger volume. We would take out either 60 milliliter or 240 milliliter of volume, depending on the patient condition. And then we would centrifuge and process that down and just get the platelets alone. We don't get the red blood cell or the white blood cell. We just get the platelets alone, and that is delivered to either the penis or into the knee or into the ankle or the hip. And how it does is that the platelets, again, they stimulate repair. But one of the things it does also is decrease inflammation. It decreases the inflammation of the area, and it stimulates other cells to come to the area to repair. And what's the end point? Increase blood flow.
Here we are
So
again.
it increases blood flow, and it increases blood flow by 3 months. And the endpoint is again increased blood flow. That's the endpoint, and that's how our tissue repair. Our tissue repair, because we need blood to bring the nutrients for the cell to start repairing and for the cell to live. We need those nutrients. So platelets call the different messengers to come in to lay down the groundwork for more blood vessels and more blood flow. So that's how the stem cell work, and it's autologous because it comes from your own body. So therefore, there's no side effect because it's your own cells from your own body, which then is delivered to an injured area. All right. So I just take yourself that you have and put a lot of it into an area to stimulate a healing. Like I said, it works great on the penis because one of its main function is to increase blood flow, but it also works in the knee. It works in the Achilles. It works in the ankle as well too.
Mm. Now, I think our listener may have slightly missed it because you said it very quickly about taking your own blood and centrifuging it, spinning it, so that we can
Yeah.
pick out those platelets. That's the beauty of
Yes.
that kind of therapy. How often is that needing to be repeated, or is it an ongoing treatment that every 6 months or 12 months one does that?
Well, for
Yeah.
ED, it's actually it's interesting for ED. The more severe you have ED. When I say severity, it's like has it been 10 years, 15 years, 20 years? I saw a patient that had 30 years of ED. Well, the longer you have ED, of course, the condition is more severe, right? As
Mhm.
time goes on. So, if you just started having ED maybe a year, or less than 5 years, it only takes one treatment. So the frequency of treatment depends on the severity of the ED. So if a man has an ED that is over 10 years, then it's pretty moderate to severe versus a man that has ED from 1 to 5 years. So the treatment will be once for a mild case. And then if he continue with his lifestyle modifications, such as diet and exercise, then he doesn't need another treatment. And if severe, then usually, he will have one treatment and then two more treatment for the whole entire year. And then if he continue with his diet and exercise regimen and be consistent about, then he may not need another treatment at all. But it all depends upon what he does after. Because I mean, I can do the treatment to boost blood flow, but he has to work on the foundation, which is his body, his what's going on in his body in order for the effect to last. So
Hmm.
that's why diet and exercise is pivotal to making the treatment last longer.
Now we've talked a little bit about the effect that some medications can have on erectile function or dysfunction, but of course, Viagra is a medication that a lot of people will have heard about and many people will be using. What is your thoughts about Viagra? What's the pluses and minuses of this drug, of using this kind of intervention?
Right, right. So how, first of all, how Viagra work is that it when you take it, it increases cyclic GMP, and cyclic GMP increases nitric oxide. So the bottom line is that it increases nitric oxide. When nitric oxide is increased, it increases blood flow, and that's how it helps with erection. But it doesn't just work on the penis alone. It also increases blood flow everywhere else too. So that's one of the side effects of Viagra is blue vision, like dizziness and vision changes, and also low blood pressure because it opens up blood vessel. You tend to have a lower blood pressure, and then sometimes you tend to pass out. That's how you get dizzy. That's
Okay.
how you get the headache as well. So if you have high blood pressure, then the effect compound, right? The effect compound when you take Viagra, and so that's what causes the common side effects is dizziness, headache, the blue vision, also and also heartburn. You get the heartburn from it as well. Men tolerate it, but some men cannot tolerate it, so they cannot take the Viagra. So that's the side effect of that. But that's the short term. But the long term side effect of Viagra is a vision loss as well as hearing loss. There's two studies that came out that looked at a long-term use of Viagra is that vision loss and hearing loss, permanent vision loss as well. And so, but I see Viagra as more as a temporizing measure. It's almost like putting a band-aid on an infected wound. Because when you take Viagra, you're just treating the symptoms. Well, you're not able to get an erection, but you're not treating the cause of why you need to have why you have ED in the first place. Is it because your blood? I mean, because you're not exercising? Is it because you have high blood pressure, high cholesterol, or diabetes? You're overweight. You're not sleeping well. Maybe you're stressed. As well too. Those are the factors that need to be considered. So before a man take Viagra, he needs to kind of look at what's his diet, what's he eating, what's his exercise routine, is he sleeping, how's his stress level, right? And so, but when you take Viagra, you don't worry about any of that. So most men that take Viagra think that, oh, I help with my erection. I don't need to do anything. When it's farthest from the truth, because when you take Viagra and you have an erection, you're just ignoring the cause of the problem. You're just putting a band-aid on an infected wound. And over time, the Viagra is not going to work anymore. Why is that? Because it's not going to work anymore because the disease, the problem, why you have ED in the first place, which is compromised blood flow, has gotten worse. Like your diabetes has gotten worse, or your blood pressure has gotten worse. It has gotten worse, and therefore you no longer have enough blood flow down there for it to be functional, even with Viagra, because you're just putting a Band-Aid on an infected wound, and the wound gets worse and worse over time. So where are you going to be after that? So you just know that, studies have shown, research has shown that 67 of men that has ED, 7 to 10 years down the road will have a heart attack. All right, will have a heart attack. So it predisposed you. So ED is really a warning sign of a cardiovascular disease. It's a warning sign that, hey, your body is saying, hey, I'm not getting enough flow down in the penis here. Let's have a look at what's going on in the body. Fix this. You don't fix this, and then it's gonna the blood flow compromise will progress to the heart. And the reason why the penis is affected first when you have blood flow compromise is because the penis artery is 1 to 2 millimeter. It's very, very small. It's the size of like an ant. That's how the diameter of the blood vessel. But the heart blood vessel is 3 to 4 millimeter, and the brain blood vessel is 6 to 8 millimeter. So what I'm trying to say is that affect the penis first because it's the smallest blood vessel, but then you don't do something about it, it's going to progress to your heart. All right. And yeah.
And what about when coming back to prostate cancer? Because a lot of men do find themselves being treated for prostate cancer by surgery, which invariably can cause varying degrees of nerve damage. I know they talk about nerve sparing, but a lot of nerves are damaged. Is that reversible?
Well, that's a good question. Kind of yes, and it depends on the man. I have seen patients that had prostate removed and had ED because the reason why is because the nerve that goes to the penis that help with erection, it just goes right on top of the prostate. It just wraps around the prostate, go to the penis. So when you remove the prostate, that nerve is stuck to it's right on top of there, so it's gonna be affected. It's either going to be cut or it's either going to be damaged because it's right on top of the prostate. So
Yeah.
it's not, it's just there, right? It's just kind of like you have to cut through the abdominal muscle to get inside to your stomach, right? It's there. So that's why that 99% of people have ED after the surgery. So having said that, I have seen men that have prostate removed that started doing like the four pillars I talk about, which is diet, exercise, sleep, and stress management, and intermittent fasting, and penile pumping. I have seen them reverse. That I've seen them have erection again, even after prostate surgery. So that tells me now that's the minority because a lot of time men that get prostate surgery are older, they're older and they become kind of despondent, and also they're not as sexually active because their wife or spouse or partner is also older, and she's probably like not interested in sexual activity either. So it's not something that the man really want to get back. So it really depends on the person, but yes, there are structural damage, and it is more of a challenging case to get back to treat for to get back to an erection. But I've seen it done. I've seen some of my patients that has had the treatment, and I have two patients that had prostate removed and didn't get the stem cell. They did not come to my office. They just undergo my group coaching program, which is diet, exercise, sleep, and stress reduction, and penis pumping and intermittent fasting. But then again, they were in their 50s and they're able to get their erection back again within about 3 months. So it is good news. And that's why I keep telling men is to keep working at it. And you never know where you never know where what's going to happen, because I truly believe that even though you have ED, you keep working at it. It's the amazing power of how you can heal over time with just diet and exercise. I have a friend who's a doctor. She's a neurologist, and she has multiple sclerosis, and she was in a wheelchair, paralyzed, could not walk. Right, is in a wheelchair for about 5 years. She changed her diet, changed her mindset, and she was able to walk again.
This isn't
And
Terry
on
Wiles, is
no
it?
medic. Yes, yeah,
Yes, well, I've
yeah.
had Terry on as a guest, and she's a very inspiring story, and it's an amazing story. And again,
I know.
a practitioner going through a personal experience, having an epiphany, which has had flow-on effects to thousands, I think, of patients because of her own experience. Um,
Absolutely.
and you've given us so much today to think about. You've raised this taboo story to a level that's, that's why I was so looking forward to talking to you. You've got a podcast, which is Sexual Health for Men podcast, which we'll obviously have links to in our show notes. And you've mentioned some courses and stuff. I want to thank you so much for joining us today and sharing your knowledge and wisdom with us.
Well, thank you for having me here. And for the listeners that want to find out more information about how to restore sexual health again, check out my YouTube channel, Truong Rehabilitation Center, or just type in my name, Ann Truong, and the channel will come up. And that's where I share everything. I put everything out there. I'm very transparent what we do, the treatment, because ultimately I want you to restore your sexual health yourself. Ultimately, I don't want you to come to my office. I don't want you to see me. I want you to have the knowledge and the power and the step that you need to do to restore your sexual health. It can be done. It just needs consistency and focus to do it. We have seen thousands of our listeners have seen improvement with just minor adjustment of just their diet, of just like stop drinking sodas and stop eating donuts every day. Just a little minor adjustment like that, and they're seeing morning wood, and they're seeing a firmer erection. So just to give you a viewer something, so we have a good morning wood smoothie, which is full of antioxidant, full of fruit and vegetables that are high in nitric oxide, that if they take every day, along with instituting intermittent fasting of 12 hours, they will see results. So you can go to the URL goodmorningwoodsmoothie.com and be able to download that smoothie recipe to use every day. Try it every day for 30 days, and just add in intermittent fasting. To stop eating after 8 p.m. And then you can eat again at 8 a.m., which is 12 hours. And we have seen a lot of our listeners seeing result. And the smoothie just involve really the spinach, arugula, blueberry, and beets, and all that all blend in to just a smoothie that you drink every day. So I'm honored to be on the show, and I hope that the listener find value in our episode.
Thank you so much. Well, if you ever needed another reason for taking control of your own health and focusing on nutrition and focusing on exercise and focusing on sleep and rest, reducing stress, which is really what this Unstress Health podcast and membership and platform is all about. Well, here's another reason now as well, sexual health. Now, we've done various programs on sexual health before. We did one with sex therapist Ian Kerner in that wonderful program, She Comes First, which would accompany this one very nicely. We've also done a great program with Dr. Rob King, a men's health specialist here in Australia and a member of our advisory panel. And of course, we have some great resources which we will share in the show notes that are connected with Dr. Ann's YouTube channel and the great resources she is only too happy to share with you. So I hope this finds you well. Until next time, this is Dr. Ron Ehrlich. Be well. Feeling stressed, overwhelmed? It's time to unstress your life. Join the Unstress Health community and transform stress into strength. build mental fitness, from self-sabotage to self-mastery. And together, let's not just survive, but thrive. Expert-led courses, curated podcasts, like-minded community and support, and much more. Visit unstresshealth.com today. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.